Well, friends, welcome to today's session. And this is a series of webinars which are taking place on various aspects of artificial intelligence. And these days, artificial intelligence is coming into our ecosystem with leaps and bounds. And today, Professor Arun Jamkar will be presenting a talk on image analysis. I think most of us already know him, but for just for introduction's sake, he's the former Vice Chancellor of Maharashtra University of Health Sciences at Nasik and a distinguished professor at Symbiosis International University at Pune, consultant healthcare and life sciences persistence systems at Pune, which and chief medical officer at Index Technologies in Cupertino in USA. Director academics at Galaxy Care Hospitals in Pune and ex-dean and professor of surgery at BJ Medical College. He's a thought leader at InPods, a software company, and also the former president at Academy of Health Professional Education. He is a unique person. He's the founder chairman of Association of Health Professional Universities of India. And he has a fellowship in medical education under Famer Foundation. And also he started the first MSP program in India in collaboration with the University of Michigan. He initiated competency-based medical education in MUHS with a faculty development program. And also he started teaching communication skills to undergraduates and did an extensive faculty development program. He was the first medical university to collaborate with Journal of Medical Education, namely Education for Health. It is a very famous international journal of medical education, and he also was the faculty development program for cardiopulmonary resuscitation and made it mandatory for internship in all medical colleges of MUHS. And he also initiated faculty development programs for competency-based health professional education in Ayush and conducted a workshop in the World Congress of Ayurveda. And he is also the recipient of Lifetime Achievement Award and Rita Sood Memorial Oration from MEU India. Over to you, sir. We are honored to have you.
Shall I share my screen?
Yes, sir.
Thank you, Sanjay. Am I audible?
Yes,
Hello?
sir, you are audible.
Yes, sir, you are audible.
Thank you, Sanjay, for inviting me to give a talk on artificial intelligence in medical imaging. I'm going to give you how do you do medical imaging analysis with AI and give you several of the success stories in various branches and domains of medical imaging. I've been introduced. I think thanks for my introduction. Basically, I'm concerned about the health care in the society. And as Martin Luther King has rightly said, of all forms of inequality, the injustice in the healthcare is the most shocking and inhuman. And I think technology can only help to have a better healthcare, which I proudly declare on my website, arunjamkar.com. And because I think among the technology, the progressive partner, that is artificial intelligence, is playing a bigger role. It refers to the simulation of human intelligence in machines that are programmed to perform tasks that normally require human intelligence, such as learning, reasoning, problem solving, and decision making. There has been very big developments, but then most of these development in low-hanging fruit is in imaging. And image analysis required what is called the GPU. And the growth of GPU is faster than CPU. And one of the big player in GPU is NVIDIA, where I went to the NVIDIA where my son works. There is a huge mural, I am an AI. And as I said, the GPU growth is faster, and then they have coming with bigger and bigger and more powerful GPUs, so that we're able to have a better analysis of images. Now, recently they unveiled monstrous 1000 AI chip with 54 billion transistors. I think this is the biggest thing to happen. Obviously, we are going to use AI for healthcare. And AI for healthcare, I just want to highlight what are the other areas. Obviously, there is a medical imaging, but there is a predictive analysis. And I'm going to talk a little later about radiomics and predictive analysis with AI. Then that will lead to personalized medicine. Obviously, at present, we are with electronic health records, and this EHR data is identifying patterns and trends. Virtual assistants, these are the few examples. I just put to the ChatGPT to write down a poem on AI in healthcare. And then the beautiful poem given by ChatGPT. In realms of the healthcare, a marvel we see, a wondrous ally called AI let it be. With algorithms and data, it comes to aid, transforming the landscape where healing is made. In hospitals and clinics, AI takes its place, assisting doctors with knowledge and grace. Diagnosis becomes swifter, more accurate too, as AI analyzes symptoms and clues. In radiology, it scans with a keen eye, spotting anomalies that may otherwise fly. From X-rays to MRI, every image it pours, detecting diseases, unlocking hidden doors. Now, I think the rest of thing is about other factors in AI, and we're just going to discuss about medical imaging. Everybody knows about AI, but then there are three terms: AI, ML, and DL. So ML is a subset of AI that includes abstruse statistical techniques that enable machines to improve. The advantage of ML is it improves by itself, given you data. Whereas the deep learning is a subset of machine learning, which composed of algorithms. And therefore, more often we use deep learning. So deep learning learns from the vast amount of data, and the algorithms gradually improve with the experience of machine learning. And what I want to highlight is today, we are exposed with a big data. First time history, this big data is available, and big data itself is meaningless because it offers a promise to unlock the novels. And an explosion of knowledge is beyond anybody's capacity. But at the same time, it would be criminal not to use this latest process data and protocol for the management of patients. And I think AI is going to be the era of the big data assistants. And we have a limitation for human intelligence. because only 20% of knowledge physician used to make diagnosis and treatment. The result is 1 in 5 diagnoses are incorrect or incomplete. And I think this limitation of human intelligence has to be substantiated by AI. And physician diagnose while everybody sees a patient. He diagnoses on the personal histories, individual biomarkers, and investigations, and physical examinations. Whereas AI can diagnose based on complex algorithms using hundreds of biomarkers, imaging results of millions of patients, aggregated published clinical research from PubMed, thousands. So I think say the AI is going to help us to treat better. And obviously, AI can give you a clue because where is the knowledge available? And I think AI goes and uses it when it is programmed because the definition of knowledge is changing. Now, half of the knowledge is to know where to find out. And I think if you say ChatGPT or maybe Google or anything, it can at least find out where is what available. So obviously the AI is to be a bigger player. At the same time, we should be concerned about what is called as sophisticated knowledge coming, but then say the human qualities need to be there. And AI would have a data going into information and knowledge, but then it all the time does everything about knowledge. And therefore, what is required is wisdom. And I think this is something which we need to understand, that we require an artificial wisdom. Now, AI and ML, DL and all augments human decision makings. And instead of traditional, when you apply AI, it goes into a different phase. Now, healthcare system has to move from what is called the reactive health to proactive health. So reactive health, individuals look for the medical help when unwell. And now once you see the proactive health, the data is captured continuously through medical grade variables, and you require AI to understand. I think I'm not going to much detail about proactive health, but then AI is going to help you to have a proactive health. Our discussion today is about imaging and the imaging analysis and what are various types. So information from CT scans, ultrasound, MRIs, pathology, endoscopy, etc., etc. So while the image comes, where it comes in several forms. So it goes into this, what is called as image handling process. So we have data. So all those images we need to integrate, clean, transfer, and extract the features is what is called as a feature engineering cycle. It's the most important thing. And while the feature engineering cycle is there, here we require both the guys, expert from say AI as well as doctors, to understand what are those features leading to diagnosis. And therefore that helps you to generate features, to select features, and we create models. And then we choose algorithms to train the model, extract, and then we create a Python file to create a best of the model. And once you deploy the model, and then the train ML model acts as a source, and then it can go and find out what is the result. So basically we have a labeled data. Suppose we have images like Tom and Jerry and data training, and we have algorithms. And at the end, once we give a new image, it can label out as Tom and Jerry. So this is a simpler thing to understand. So I don't know, I'm not going to say much detail about machine learning and what are the various types. So machine learning, we have what is called as unsupervised machine learning and supervised machine learning. In the supervised machine learning, what we do is we give images with the data, and therefore the classification is there, and then we are able to find out to match, and there are several say systems available. And the commonest one we use is support vector machine, or maybe random forest or nearest neighbor. And in unsupervised machine learning, what we do is we just give the disease profile and the data, and then ask the system to find out what are those data available. And then it goes into clustering, and then with the k-mean clustering and hierarchical clustering, we're able to identify. So let us say we are talking about COVID. So suppose you know that supervised learning will identify, say radiologists will identify what are those features in X-ray chest which were positive in, say, present in positive COVID patients. And therefore it will be labeled and then it will train. Whereas in unsupervised machine learning, we'll give maybe 1,000 X-rays of COVID, and then it will find out with the clusters what are those commonly seen. And I think it is a combination of both. So supervised and unsupervised as two different approaches. Supervised machine learning involves training model and label data. I'm not going to much detail because this will be more of engineering. And I think what is required is a combination of supervised and unsupervised machine learning. In a deep learning, you go down an application of machine learning that uses complex algorithms. And then these complex algorithms, they go into hand in hand. And then what is there is we have what is called the commonest thing called a neural network, where we have input and then the hidden layers. And these hidden layers, the number of hidden layers, say, depend upon the complexity, and we have outcome. And therefore, the number of hidden layers go on increasing with these complexities, and then outcome becomes small. So maybe there might be 3 hidden layers, maybe 5 hidden layers. And I think this whole thing goes in. So in nutshell, we have AI, we have ML, and then supervised machine learning and deep learning and unsupervised learning as a component. So this whole thing of CNN, what is a computerized, say, computer network, say, works like a human brain with a biological network. And then these hidden layers are those where we get all those neurons inside the brain. So the development of ML and AI, this is what is called as a chart where you can see how it has developed. And then FDA has permitted long back the medical devices to use AI to detect diabetic retinopathy. But before that, the pathology was there, but I think we are not using much of, say, AI image analysis in pathology. Now, what is important is we have to go further to understand what is called as explainable AI. And explainable AI can be easily understood by humans as an end result, a sign point of XAI being rapidly adopted across the healthcare. So if you see the growth of human AI, now at present it is crossing, but in the maybe future, it is going to be exceeding the human performance. And I think there we require some, how exactly we can use all that AI system for human use. These are the deep learning platforms. Normally, students use TensorFlow or Keras. So what I'm going to do is identify what are the things being done.
About this. So joining us now is our expert, Tommaso. Tommaso, great to have you.
Thank you. Nice to meet you, Chris.
So maybe you can tell us in what areas artificial intelligence is already integrated into the daily workflow.
As you may know, as part of the clinical workflow of radiotherapy, one needs to contour the organs at risk because basically you want to avoid them during the intervention. You want to preserve them. You don't want to kill these organs. And this is a tedious process. It takes time, it's costly. The clinician has to contour all the organs. And this is exactly a perfect example where AI can make an impact by providing automation and therefore help streamline the contouring process and increase the throughput of radiotherapy sites.
Okay.
And this is just an example of out of the 30 plus products that we are here that are already AI powered. You can check them out on the booth.
You know what? That's an invitation. So why don't we do that? Let's go check them out. Now let's have a closer look at how AI is expanding precision medicine with the help of this brand new device here presented at the RSNA 2017. And with that, I'd like to welcome our expert, Mark. Mark, great to have you.
How you doing?
I've got to tell you, I've never been on a scanner like this before. So what's so special about this?
Yeah, so what we're introducing this year at RSNA is the fast integrated workflow with the new fast 3D camera just above you there.
Okay.
Basically, this is powered by artificial intelligence. We've got a lot of algorithms in there working as soon as I press one button to position you. Properly. So in the past, we used to have to do all of this manually, but now what it's done is determined where you are lying on the table, whether you're head first or feet first. It's already checked the position from shoulder to hip and the perfect isocentering as well. So now you're ready to be scanned.
Uh-oh. Oh, I got to tell you, Mark, This is kind of comfortable.
Certainly is, but we don't want you on there for too long.
Now, I know what you're thinking, but no, this is not a game chair. I'm trying to find out how AI is actually changing the way radiologists work. So for this, I'd like to welcome our expert, Valentin.
Hi, Chris. How are you doing?
Nice to have you. So maybe you can tell me how this actually works. What is this about?
In our advanced visualization software, Syngovia, already today we make use of a broad portfolio of AI-powered algorithms to help radiologists in their reading.
So maybe you can give us a specific example of how it assists radiologists?
Absolutely. So one tool we have newly introduced now with Syngovia BB30 is that the software is supporting the radiologists by automatically segmenting for them the lung, the heart, and the aorta. And all that is powered by AI algorithms.
That is amazing.
This is really great.
You mind if I stick around a little bit and try it out?
Not at all. Go for it.
Time just flies by when you're having fun. Like it is the case in many other industries, artificial intelligence is the epitome of digitalizing health. About this. So join.
So was the audio of video there, Sanjay?
Yes, sir.
Okay, yeah.
It was okay.
Okay, I was concerned. Now I'm just going to give you a brief outline of various branches where we have images and where AI is identifying. The first one, the lowest, is dermatology, where the dermatological classification of skin cancer. And then with a deep neural network, they were able to identify cancer. And it was far better because we test the performance against 21 board certified dermatologists on biopsy proven clinical images. So what is required is the data. And I think now recently, this has been used. And then first term, there is an app on where you have to just send 2 photographs and then it gives you diagnosis. And then I think what is required is the data. So here I just want to point out that we in India, the data is too much available. And therefore, as suppose some dermatologist trying to do, he might have already thousands of images. So all required is various profiles of each image and say multiple images of different diseases. And then you can go into developing of image extraction and feature engineering cycle. So this is an app available. Then other thing where it has been used is AI has been used for diabetic retinopathy, and this is FDA approved. Where what is the when you then say it is very easy because the lesions are not very very often. There are 4 or 5 types, and maybe lipids, hemorrhages, microaneurysm, and then you can find out that analysis of diabetic retinopathy with a machine which is assisted by AI is reasonably fast. Then it can do for optic disc abnormalities. It can do for glaucoma. So these are the various papers available where the AI is being used for the fundoscopy in various diseases. I think it is one of the low-hanging fruit. And we are in persistent, we are trying to improve and find out how we can use AI for the retinopathy. Then obviously we come to radiology, where X-ray chest, CT scan, CT angio, MR angio, all can be done. And then Siemens is working hard. Siemens what's called Healthy Years, where all these AI being used for multiple sites. So let us see few examples. So maybe you can use it for X-ray chest, and then we can have 2, a frontal and a lateral, and then output, and then you are able to identify all those various combinations of diseases. And then we can find out that it gives you far better confidence of all these findings like atelectasis, consolidation, edema, effusion. And I think it gives you reasonably, say, dual net, one of the neural network, which gives you almost more than or better than, say, an individual radiologist. And deep learning chest of ChestNet, another network where you can see the deep learning algorithms are giving far better success. And this is the result. and where we can find out and say that the confidence level of radiologist and say algorithms is almost better, or maybe there is no difference. And generative analysis of say magnetic resonance imaging, where it is, I think, same pattern is seen. So we have been used to find out how exactly we do, and therefore what we are trying to plan is it does what is called as image segmentation and annotation. So while we do an image is there, it segments, and therefore image classification and semantic segmentation, it can help. And then it can, you can have what is called as annotation. So annotation involves labeling and marking of regions of structures within an image. And in a medical image, you can either physically do by what's manually do, or maybe semi-automatic, or maybe weakly supervised. And therefore, these are the two technologies to identify and find out imitations, annotation and segmentation. Now, we have recently the corona, and I think we were doing far better in corona because it was far better identified. So I work as a mentor to a company called Rises, where we have a model of the lung capacity, and then the prediction of AI system was better. And then we can follow them, and then in X-ray chest, the appearance of was far better. Now, there is a nice paper on CT and RT-PCR comparison, and it has been found out that the AI imaging and analysis of chest CT, it was giving you earlier diagnosis of COVID, maybe another 2 days. I think that's why before the RT-PCR becomes positive, the say the test becomes applicable when you have say say chest CT with an AI. As a net result, the problems will be less. There is less complications. I think this was the paper, and I think this is something which we could be proud of. This is already available in India. There's something called a Sachin Sharma, where he was doing AI for CT scan for COVID. Then the another thing that is very applicable is mammography. And in mammography, so we can have a digital mammography, and then we can find out that mammographic densities has been compared with AI, and then the computer vision, and then you can find out the efficacy of radiology resident, the neural network, and then it was increasing better and better. And these are the several papers to find out how AI is doing far better in mammography. And these are the recent paper where 25,856 women were identified, and then the mammographic diagnosis by AI was better than 7 leading, say, radiologists. So this is how it is going, that it's a low, one of the best results that we have of AI in mammography. The gastroscopy, obviously, there are a lot of things we can do in imaging. Now, in a gastroscopy, either we can have direct endoscopy or a virtual endoscopy. And then, say, for those, I think everybody is a doctor, so upper GI, where you can go up to esophagus and up to the, say stomach. Whereas lower GI, it can comes to the colon, up to the insert from rectum. And then area midway can be taken care by capsule endoscopy. And then we can have either direct or a virtual. So in a direct, we are doing passing an endoscope. Whereas in virtual, it's visualized by CT scan. And these are the results of using AI for Helicobacter pylori infection. You can see the sensitivity is 75%, and with far better results available. And then deep learning of gastric cancer identification by a gastric net, where the performance was 96.3%. The deep learning algorithms in histopathology is identifying through gastric cancer, where we are using those technology of segmentation, detection, and classification. Recently, I was invited by Samir for an international conference of advances in radiology, where the topic was no longer a science fiction, artificial intelligence and robotics transforming the era of digital healthcare. And then when I was invited, I remembered this movie called A Fantastic Voyage. In A Fantastic Voyage, it's a 1966 movie where they do miniaturization and create a submarine and put the scientists inside the submarine. And then that submarine is introduced to a van, and then it goes inside, and then it has to identify and say dissolve a clot in the brain. And it was one of the most enchanting science fiction. And it was subsequently another edition has come with Asimov. So if you see, we have a science fiction coming in reality, what is called as a capsule endoscopy, where you have to just eat one capsule. Now, this has an optical dome, a lens, and then there is it goes on capturing the images, and then it goes on transmitting images outside. Now, as we have seen, upper GI and lower GI, that can be visualized by direct endoscopy, whereas the middle small bowel is not visualized. And therefore, we can do this by capsule endoscopy. And you can see, because it's going through all the length of small bowel, it gives you, say, thousands and thousands of images. And it is physically impossible to identify. And therefore, in the capsule endoscopy, where we can find out by using AI technique, the esophagus, stomach, duodenum, small bowel, it was going better and better. And then it was identifying the outcome, whether it is a polyp or not, or the site of bleeding, with capsule endoscopy images coming by AI. And then we can find out that bubbles, turbid, clear image, and all those, the percentage, you can see 98%, the accuracy was there. Now, let us go to what's called the virtual colonoscopy, where it's a CT or MRI image. And I think this can be very well diagnosed with, say, maybe polyp. Now in US, the polyps are very common. And I think you can find out we have 96 filters, and polyp was not polyp would be there. And it has been used for, identifying polyps with virtual endoscopy. Now,
Artifacts and the analysis of the motion of the endoscope. One main contribution is the automatic localization of polyps in clinical colonoscopy. Colonoscopy consists of two different phases, insertion and withdrawal. During the insertion phase, the colonoscopist drives the endoscope to the second. During the withdrawal phase, the actual intervention is performed.
An image can be viewed as a 3D representation in which shadows correspond to valleys. In colonoscopy images, these valleys correspond to shadows created by the polyps. We first clean the image to remove undesirable shadows. Finally, we integrate valley information in an intelligent way to highlight those areas of the image more likely to contain a polyp.
The final outcome is a heat map in which the hottest point corresponds to the presence of the polyp. We verified that this map corresponds to the actual regions that attract the attention of the physicians. We validated this by means of eye tracking experiments. Artifacts.
So I think there was a marvelous capacity of AI for identifying the colonic polyps. Now let us go to the AI systems in histopathology, where I think FDA has approved this before, but I think they didn't do it much. but I think everybody is trying to do, say, AI image analysis of histopathology. And then the same deep learning. And I think here we need to train the system for, say, various cells and then identifying their appearance with maybe malignancy and all that. So by utilizing machine learning, the whole slide digital image, we have developed a proof of concept of automatic detection of breast cancer metastasis in lymph nodes. Our early results show that metastatic breast tumor is lymph node can be detected by AI, and then accuracy is 89.6%. Now, what is more important today is we're using it for all those things, and then stromal cells and all those cells and identifying, and then what is called as a handcrafted approach to identify this is the supervised machine learning and maybe labeling. And now there are various startups like Page, where then we can have most important thing is now instead of a slide, which is maybe a paraffin cut slide, we are going into what is called as a 3D images, where the whole tissue has to be given. And then I think this is the biggest thing to happen, because the scope of the images would increase, that instead of one layer, it can give whole tissue. And then this is one of the biggest things that is happening is a 3D CT, say 3D images of say tissue pathology. Now neurosurgeons are using it, and it gives such a nice advantage that instead of you waiting for maybe biopsy in the theater, it can directly do. Now this is one of the areas where automatic tissue diagnosis pipeline.
I think that's an artifact of a training set.
So the greatest advantage is that whole thing can be done from theater, and then biopsy is submitted through the system, and everything is done. So there is no chances of mistakes, and it is very fast. So these are the various papers on AI in neuro-oncology. And what is important now to understand is radiologist and the system has to work together. So what is called as a collaborative intelligence, and everybody is concerned about role of radiologist, role of pathologist, and role of all those image analyzing experts. But I think we need to work together. So now we have what is called autopilots, and then everybody knows that nobody is going to let the aeroplane fly with autopilots. So we require automatic navigation. At the same time, the human pilots are there, and therefore we need not concern of the presence of AI system to destroy the role of radiologist. So radiologist will be always required, but then radiologists who do not use AI will be replaced by radiologists who use AI. So I think this is far better to understand that it is going to augment the decision-making of radiologists. Now, the new concept is what is called as the radiomics. Radiomics is a field of medical research and image analysis that focuses on extracting quantitative features and data from the medical images, CT scans, MRI, and then it involves an high output extraction and analysis of large number of quantitative features of these images, which can provide information about tumor characteristic, treatment response, and then underlying principle of analysis, this wealth of information which is beyond the human eye, can be used to find out what the prediction and going into what is called as a personalized medicine. All that now this is an entirely new area where AI imaging and all these characteristics can be used to precisely find out what is the outcome. So the example, maybe you have feature recognition, where all those features available from histogram, geometry, and then model building and model assessment. And then we can find out, now this is a case coming from Taiwan, where they were able to identify with the predictive model to find out what happens to each case and going into what's called a personalized medicine. So this, I think, latest thing to happen is AI image analysis with the radiomics is giving you the predictive value for what has happened to the treatment protocols, what is going to have maybe the follow-up and outcome. So other areas where it has been used is coronary angio, where the artery-centric extraction, and then we can find out the plaque characterization, stenosis characterization, and it becomes very fast. And I think this is one which requires very fast diagnosis. And here also we do segmenting, and I think the results are very, very promising. And these are the analysis of a left ventricular myocardium, it's CT angio, and then we have multiple hidden layers and find out whether there's a stenosis or a plaque, and you can find out with the AI systems. Nuclear medicine is another area where we have a lot of images, maybe planning, and then we get into all those workflows of scanning, reading, and reporting. And then the Parkinson disease, where in single photon emission photography and dopamine receptor scans that they use. And AI was able to identify the SPECT receptor scans with a 96.3% sensitivity. So these are the various models available. And then I think somebody has to understand which are those softwares available. So in conclusion, I'm coming to the conclusion. The AI made a significant advances in the field of medical imaging, revolutionizing the way medical profession analyze. So automatic, say, image analysis, AI algorithm can analyze medical images such as X-rays, CT scans, MRI, and mammogram to detect abnormalities and assist the diagnosis. These algorithms can identify patterns, anomalies, and potential indicator of diseases, enabling early detection and improvement of the treatment outcomes. Now, most important is the process by which we do is image segmentation annotations, and they annotate specific clusters with either manual or maybe semi-automatic, and these assist in precise measurement, tumor delineation, organ localization, and surgical planning. So AI can give you a computer diagnosis as a second opinion for radiologists by providing computer-aided diagnosis. Image reconstruction enhancement can be done because that is how whatever image available can be enhanced and then improve the quality and the resolution of images, and AI can generate high fidelity images. It can have a better workflow and say optimization, then research and training, and lastly, radiomics and predictive modeling. AI techniques enable the extraction of quantitative features from medical images, which can be combined with clinical data and develop predictive models. And I think this is something that is happening in future. Technologies such as deep learning, machine learning, AI promise to have benign solutions in thorny, complex problems, but this view is misguided. While AI has revolutionized the aspect of technical medicine, it has brought its in way to the practical and conceptual and pedagogical and ethical conundrums. For example, widespread adoption of technologies threaten to shift emphasis from hands-on embodied clinical work to dissembled technology-enhanced fuzzy scenarios, muddying ethical responsibilities. Where AI can offer powerful sharpening of the diagnostic accuracy and treatment, the core technologies and warm hands on medicine need to walk hand in hand. machines lack human qualities such as empathy and compassion, and therefore patient must pursue that consultations are being led by human doctors. Furthermore, patients cannot be expected to immediately trust AI. So thank you.
Thank you, sir. I think the coming future is very, very different from what we are used to. And I think the very important application of AI is going to be in bulk, large number of patients, bulk diagnosis, bulk imaging. I reckon Dr. Avinash Supa is here. Sir, would you like to say something?
No, thank you. I think, thank you, Sanjay, for organizing this. Arun, it was an excellent talk with a very wide kind of a spectrum of various diseases. I think one question I wanted to ask you, if I can ask you this question. Can I ask you a question? Anu?
Yes, of course, of course.
Okay. I think, see, we have been following this AI and deep learning for now almost last 7-8 years. I think we have been able to start into treatment. We have now validated it also. Quite a few number of validations have come. How much it has come into practice? And as you rightly said, we have to walk in hand rather than hands-on. I mean, how much, I think, which areas it has been in practice today and which areas in future you think will pick up in the next few years?
I think in India, we are trying to do a lot of things in screening of diabetic retinopathy. Some of my friends who do mammography, they are using AI for understanding. And I think several areas where AI is being used for diagnosing X-ray chest. Now, if you see X-ray chest, 90% of X-ray chest are normal. I think AI would be far better in declaring the X-ray chest as normal. Obviously, in India, we are not doing much, but I think abroad, everywhere the AI is being used for image analysis. I think all those fundoscopy machines are coming with built-in AI. Now, even ECG machines are coming with built-in AI to diagnose. I think it will take some time to have similar application in AI. In Persistent, we are trying to develop 4 or 5 areas where we want to develop AI systems, because all these AI systems would be reasonably cheap in India. So what advantage we have in India is a population. And because of population, the data of all these patients is available with multiple times. And I think data is today's oil. So I think this data we need to use. And all of us like us need to identify and say maybe convince people to utilize their data. And for all the AI scientists are reasonably available, I think we need to develop a Make in India for AI in imaging so that the dollars would come to us.
Okay, interesting. Thank you. Thank you so much.
Paramveer Kaushal, would you like
Hello,
to?
sir.
Hello.
Yes. Hello, Dr. Arun. Hi, Dr. Sanjay. Thank you. This nice topic.
Yeah.
I have one question. Like in future, the AI will be like a blessing, or it will be a curse to a physicians or a medical practice. With the time, it's like use or lose the skills. So, like I just like simple skill, like with the time, like physicians are losing skills of auscultations or small reading EKGs because ECG machine tell that, oh, this rhythm belongs to this part or arrhythmias.
No, I think we need to understand that all this AI is going to just assist physician. So maybe even it's an ECG abnormality. It will be giving you far better early recognition for those abnormalities. Now, one of the basic advantage of AI is it is unbiased. Let us say I'm looking at X-ray chest and I see some cavity somewhere. I just don't bother and I will declare tuberculosis. Whereas AI won't stop at looking at cavity. It will go on scan remaining X-ray to find out whether there is additional information available. So because AI is not biased. So I think this is an advantage. Same thing can happen with a coronary angiography. Suppose there is some block somewhere, it will go and identify in the CT angio where are other blocks available. I think that is how AI will assist and improve our healthcare.
Yes,
Thank you,
as
Dr.
sir
Jamkar.
gave the example of the airline pilot. Now these days most airlines they run on automatic pilot, but the pilot is still there.
Yeah. No,
Thank you.
I was just trying to teach skills, and there was one video of a aeroplane which is hit by birds, and it was landing in the Hudson River. And this is because of all AI system of which suggested that it should land in water rather than go to the next airport. And then everybody was saved. So I think this is unbiased, and that can help you.
I
Thank
think
you.
that example of airplane pilots was fantastic actually. That I think clarified many of the concepts which are likely to happen in future in many other specialties.
Dr.
And-
Prateek,
Good evening, sir.
Good
Thank you, sir.
evening.
It was an excellent presentation. Sir, I have one doubt. Like we have done studies. I'm a forensic medicine professor, sir, and we have there are many reports and so which state the CT scan have a little less features when we look at practically for postmortem. And now virtuopsy is come. Now a CT scan with AI enabled will be better than virtuopsy or a practically done manual autopsy, sir?
No, I think we are not yet mature enough to give the legal opinions of maybe postmortem. But I think nowhere in the world still it is being used maybe the CT scan analysis or MRI analysis for AI for postmortem. But I think instead of the CT, if it is an MRI, and then I think in the images would be too many, and there AI will definitely help you. At the same time, the expert forensic professor, his opinion will be final.
Sir, one more last question, sir. You are talking about unbiased. I was just going through a little AI. Sir, AI works on the data that we train or we feed
Yes,
to the AI machine.
yes.
So what I feed to the AI will be little different because we, me and my colleague, we have different minds and we have our different opinions. So based on my interpretations, my data collection, my feeding, the AI would react, which may not go hand in hand with my colleague's opinion, sir. Am I right, or I'm going in the wrong direction, sir?
No, no, no. While we are using that image feature engineering cycle, we'll have multiple scientists coming into play. And let us say there is some image and some pathology which diagnosis is given. We'll take multiple opinions. At the same time, because the data will be extensive, and therefore for each of these pathologies, we require to have at least maybe 100 to 1,000 copies. That's why the one person can go and maybe become biased, but maybe if he has 1,000 images or 1,000 data cases, then it will be better because it's a collective knowledge.
True, sir. Thank you, sir.
Dr. Neeta Kumar is asking, how do we train future physicians if AI is doing most of our work?
No, we are not trying to replace or do anything. We will require physicians, we require everybody. And only thing is AI, let us say you are sitting in OPD and the symptom complex goes through AI system to find out which one can give a triage, which patient has to be seen first. And therefore that is going to help us. It's not going to treat. And suppose the protocols are there, it will identify which protocol would be used, because we haven't gone into treatment domains in this lecture. But I think it is going to help us far better. Now, one of the things which has been doing is what is called NGS-based technologies to match the genes and to identify which monoclonal antibody and which treatment protocol is useful. And therefore, because we have more than 500 gene combinations available in a tumor, it will be physically impossible to find out which exactly would work. And AI will definitely give you a clue that how the treatment protocol could be personalized and effective.
Yes, sir. In fact, it is not a very big technology, only the attitude towards this technology has to change.
And I think we need to just forget, there is a slide, that radiologists would be replaced by those who understand AI.
Yes.
So
Same applies to
optimally
all
collaborate with the
pathologists
technology.
as well as medical teachers who use AI. They will replace those who don't use. In fact, we are having a course in which we are using ChatGPT for medical education.
Yeah.
And it is a hit from right from very first day.
Now, in pathology, so suppose you have a scan image of a slide. Now, the scanning would be far faster with AI, and it will do multiple slides, and therefore it will do far better diagnosis. Whereas it is physically, maybe humanly impossible to identify going to all copies. Whereas a scan image, it can have, say, 1,000 images of one patient, and it can still give you the misdiagnosis, maybe small tumor somewhere or some small cellular changes. I think it is going to give far better help in diagnosing pathology.
Does AI diagnosis overdiagnosis in imaging?
Maybe, but that's at the end, we require a physician to identify whether it is over.
Yes. I mean, in hematology, since almost 20 years, it tells how many cells are there, how many lymphocytes, neutrophils, etc. in a cell counter. But at the end, a human pathologist has to certify it, see the actual slide also. In fact, now 9th standard students, CBSE has introduced a topic, a whole book is there on the curriculum on artificial intelligence in the curriculum of 9th standard all over India. And the way trend is going, I think it will reach 7th standard or 5th standard, etc.
I think that's interesting, Sanjay.
I think we just wanted to work on cell counters because there is so much of variation that somebody, the professor of pathology was ex-vice chancellor of Madhya Pradesh University. He's an expert, and he was able to identify all diseases with cell counter. And I think if it is aided by AI, his diagnosis would be far better. I think AI, I didn't get anything on AI in cell counter images.
I think there have been so many apps which have come. When I was a dean, actually, our skin department developed an app for the skin diseases.
Yeah.
It used to just scan app and they used to give some suggestions about app. Also, there is one cholecystectomy app. But I personally feel there is a very poor use of these apps still today at a ground level. Maybe people will realize it. As you rightly said, we need to have physicians replaced with those who know AI and how to use AI. So I think courses like this, Sanjay, what you are organizing, will definitely be of a great help for people to use AI more effectively rather than replacing physicians.
Yes.
Avinash, I showed one slide about derm, where you have to just upload 2 images of the skin disease, and then it gives you with far better accuracy. And it's an American. At the end, if you want to contact a dermatologist, then it only asks you for charge. I think what is important is all skin images that we have with multiple dermatologists across the country should be used and pulled together with a diagnostic efficacy so that it's a collaborative intelligence.
I think collaborative intelligence is the key word today, I think. So that's what is worth going ahead with.
Yeah.
I think Dr. Sonal wants to ask something.
Yes.
Thank you so
Dr.
much.
Sonal is a DM in hematology from AIIMS, and he's helping us with the AI for pathologists,
Oh, wow.
especially
Oh.
the hematology part of it.
Thank
Yes,
you
Dr.
so much.
Sonal.
Yes, thank you, sir. It was a wonderful talk and a very great learning experience. So just wanted, so as you said that there needs to be an AI on peripheral smear, the CBC slides. So there are AI systems now for that. And I guess in the presentation that I make, I'll be sharing my experience. From close to 1.5 years, I'm using that digital microscopy and AI for hematology smears, so CBC smears. That's it.
So I think we need to take shelter of say not much variation of the cellular images in hematology, because it's if it's histopathology, then there is a far more variation, whereas it's a hematology, the variation would be less, and therefore the data would be perfect and better, and we do far more hematology than histopathology. So I think
Right,
that could be increasing our efficacy.
So the public health impact is more because hematology is everywhere, anemia is everywhere. So it's slower to come in hematology because of its single cells diagnosis. But impact, the time when it matures into real world applicable AIs, which need minimal interventions, then it would be game changer in terms of public health.
No, I as a consultant with Persistent, I would offer you collaboration with you for developing AI with hematology.
That's wonderful, sir. That will be really nice.
Yeah.
What is the scope of AI in community screening today in India for various diseases?
So
there was
we
one
are running
paper
another
about,
course on geographical information system in health. So linking the Google Earth and maps with the disease patterns and disease related thematic maps, and generating epidemic alerts, automatic epidemic alerts. This is where work is going on. I mean, what we have seen.
Avinash, one of the example that I can quote is Cuff Engine. There's one app where you just cuff in front of mobile, and with the cuff frequency, it was able to diagnose COVID with a 98% accuracy. So I think we need to have far more understanding of how the AI analysis of various, say, data is available.
Yes, sir. And during COVID days, we used to get maps. I mean, daily maps of spread of COVID in our own state. And they were updated this Arogya Setu. If you go to Arogya Setu, an app was available, made compulsory to everyone. The technology is there, we are not using it.
Now, I can quote an example of somebody called Karim Khan, where after the first patient of COVID in China, he analyzed all say flight data, patients going, movement of those patients, and he was able to identify where exactly the second patient will come with 99% accuracy. And this was one of the wonderful things for AI using for say what is called epidemiology. I think it was, I'm really gratified that there is so much of heat we can generate for using AI.
Yes, sir. Thank you very much, sir. I mean, the heat has really been generated, and I think our main responsibility is to keep the fire going and maybe carry it to the next levels, and with collaborative intelligence, we will be able to do it.
So I want to utilize this platform to invite all the physicians concerned who have a data of images to approach us so that we'll be able to develop AI. Because at the end, what is important is the data.
Yes, sir.
Thank you.
Thank you so much.
Thank you, sir.